All right, today we're going to talk about one of the heavy hitters in the world of medicine. It's a super antibiotic used in hospitals for some really serious infections. But this isn't just a science lesson. It's actually a story about a powerful team, a hero and its bodyguard, on a life or death mission inside the human body. So let's just boil this whole thing down to one simple question, and it's going to frame everything we talk about today. How do you protect a hero on a dangerous mission? The answer to that is the secret sauce behind why this antibiotic is so incredibly effective. You see, this drug isn't just one thing. It's actually a team of two. And for our story, we're going to give them some cool code names: the warhead and the shield. And each one has a very specific and totally different job to do. Let's break down the team, shall we? On one side, you've got Piperacillin. That's our warhead. It's a powerhouse penicillin antibiotic, and its sole mission is to find bacteria and obliterate their cell walls. Then you have Tazobactam, our shield. Now here's the interesting part. It's not an antibiotic at all. Its only purpose, its entire reason for being, is to protect the warhead. So you're probably thinking, wait a second, why does a powerful warhead even need a shield? Well, like a lot of heroes in our favorite stories, Piperacillin has a secret weakness, a critical vulnerability that the enemy knows exactly how to exploit. And here's the villain's secret weapon. It's an enzyme called beta-lactamase. The best way to think of these things is like tiny molecular scissors that bacteria crank out. Their one and only job is to hunt down antibiotics like our hero, Piperacillin, and literally cut them to pieces before they can do any damage. It renders the antibiotic completely useless. Okay, so this is how the mission goes down. It's a beautiful synergistic attack. First, the warhead, Piperacillin, closes in on the enemy bacterium. The bacterium totally panics and sends out its army of scissors to take it out. But then, and this is the key moment, Tazobactam, the shield, makes the ultimate sacrifice. It dives in front, grabbing onto all those scissors and binding to them, completely disarming them. With the path now clear, the warhead is free to cruise right up to the bacterial cell wall and finish the job. Mission accomplished. So now that we see how it works, who or what is this powerful duo actually going after? Let's take a look at the enemies on their official hit list. And the answer is a lot of the nasty stuff. Because of that protective shield, this drug combination is what we call broad spectrum. It can take on gram-positive bacteria, the ones with those thick cell walls. It can also handle a whole range of gram-negative bacteria, which are trickier with their thin but complex outer layers. It even goes after anaerobic bacteria. Those are the ones that hate oxygen and cause some really gnarly deep tissue infections. But out of all of them, there's one bad guy that this combo is famous for taking down. Its number one target is a bacterium called Pseudomonas aeruginosa. This thing is a notoriously tough customer, a real problem in hospitals that often targets the sickest, most vulnerable patients. And this drug is one of our absolute frontline weapons against it. Okay, so we know what it fights and how it fights, but what actually happens once it's been deployed? Let's follow this drug on its journey through the human body. So first off, the mission always starts in an IV bag. You can't take this as a pill because your gut would just destroy it. From there, it gets into the bloodstream and spreads out everywhere. It gets deep into tissues like the lungs and skin, exactly where these tough infections like to hide. And finally, after its job is done, it makes its exit. It's almost completely filtered out by the kidneys. And that's super important because it means doctors have to be really careful and adjust the dose for anyone who has kidney issues. Of course, no mission is ever perfectly clean. There's always some risk of collateral damage. And even our hero drug here isn't perfect. Using it comes with its own set of potential risks and side effects. The most common issues are kind of the usual suspects for strong antibiotics. Things like diarrhea, maybe some nausea and vomiting, or skin rashes. And remember, our warhead piperacillin is part of the penicillin family. So there's always a risk of allergic reactions, and those can be anything from a minor rash to something much more serious. But there's one risk that's especially important to talk about. It's a really severe type of diarrhea that's caused by a nasty bacterium called C. diff. See, the problem with a broad-spectrum antibiotic is that it's not picky. It kills the bad guys, for sure, but it also wipes out a lot of the good bacteria living in your gut. And when that happens, it clears the way for troublemakers like C. diff to move in and take over. And that brings us to the final chapter of our story. And honestly, it's the most urgent one. There's a huge threat facing our hero duo, because the enemy is evolving. And let me be clear, this is not some small, far-off problem. Antibiotic resistance is a massive, and I mean massive, global health concern. It threatens to make some of our best weapons, like this one, totally obsolete. So what is resistance in the context of our story? Well, think of it this way. The bacteria evolve. They build bigger, badder, more powerful molecular scissors, new types of beta-lactamases that are so tough, even our shield, Tazobactam, can't stop them. The shield gets overwhelmed, the warhead gets chopped up, and the drug just stops working. And this leaves us with a really critical and kind of scary question for the future of medicine. We've seen how this incredible team has saved countless lives because this shield protects the warhead. But as bacteria get smarter and their weapons get stronger, we have to face a new version of the question we started with. What happens when the shield is no longer enough?